Okay, we'll start. Good afternoon, good morning, everyone, depending on where you are in the world. My name is Angelica Pino, and I'm the Grants Manager and Capacity Strengthening Specialist at the Sexual Violence Research Initiative, and I'm based in Johannesburg, South Africa. I am very pleased to welcome you to this webinar today, co-hosted with our partners from the World Refugee Commission and the Gender-Based Violence Area Responsibility Global Protection Cluster to discuss sexual violence against men and boys in humanitarian settings and the need for strengthening a multisectoral response. The webinar will be conducted in English, but we have also simultaneous interpretation available into Arabic and French. You just need to click on the globe icon at the bottom on the right side of your screen to select the preferred language. I also invite you to introduce yourself in the chat. I'm very glad to see that many of you have done so already. So what is the agenda for today? Our agenda for today includes a presentation of a new guidance note for the field by Sarah Martin from the Based Violence Areas of Responsibility Community of Practice. A panel discussion moderated by Dale Busher, Vice President for Programs at the Women's Refugee Commission, and with the participation of 3 guests with a wealth of experience in the field. Mehi Verputten from Médecins Sans Frontières, Galo Kisanga from HIAS in South America, and Karina Hickling, Child and Adolescent Survivor Initiative, Child Protection Area of Responsibility. The panel will be followed by a Q&A session and some final recommendations for the field. But before we start with the program, the agenda, we would like to take a quick poll to see how the participants in this webinar feel about being able to respond to male survivors. You will see now that the poll comes to your screen and you can vote there directly, nothing else to click. And there are 3 quick questions in the poll. And these questions are, have you ever received training on working with male survivors? So you say yes, no. Are there male survivors in the context where you work? Again, yes, no. And do you feel comfortable to support any future male survivors that may disclose? So very simple 3 questions. You have a minute to answer, and then we will show the results of the quick poll. So go on, and you can participate in the poll. I think just maybe 50 seconds more to give people to answer the poll. Lisa, you think we are ready with the poll? I think we're about to close the poll and we will show the results. So very interesting, of course. Have you ever received training? 73% no. Are there male survivors in your context where you work? Yes, 84%. Do you feel comfortable to support any future male survivors to be disclosed? Yes, 70%, no, 30%. So of course, very interesting and telling, I would say, responses. And I think I can see the usefulness of this guidance notes that Sarah is going to introduce us to. Thank you very much for the very, very interesting answers. So now I'm going to hand over to Sarah Martin, who is going to present the guidance note. Sarah Martin has over 20 years of experience in research, advocacy, training, and project management with international organizations. She specializes in strengthening gender-based violence, prevention, and response in humanitarian settings. She has had a number of positions, including the GBV area of responsibilities, regional emergency, GBV advisor for Asia and the Pacific, and senior gender capacity advisor for UNHCR, for the Syrian refugee response in Jordan. She conducted the field research in Italy and Kenya for the Women's Refugee Commission Sexual Violence Project and is on their advisory committee. So thank you very much, Sarah, and over to you presenting us the guide today.
Thank you very much, Angelica, and it's nice to be here today. If we could put up the PowerPoint presentation, I'll start to show you some information about our guidelines. But before we start, I want to thank especially Sarah Chenoweth, who is on sabbatical right now. She's the lead investigator, director, and the primary author of Women's Refugee Commission's Sexual Violence Project from its inception until 2020. We're extremely grateful for her work and vision. So it's very important also when we're talking about sexual violence against men and boys that we present the Women's Refugee Commission's perspective and how we strive to prioritize accountability to women and girls throughout this project. So we do this by exploring how sexual violence against men and boys impacts the lives of women and girls, by exploring how sexual violence against men and boys also intersects with violence against women and girls. We're advocating for services and attention to survivors of all genders. And we dispel the myth that services and treatment are available for sexual violence survivors who identify as women and girls, but not for men and boys. This is a harmful myth that we've found throughout our research. We know that services and treatment are typically limited for survivors of all genders. And we also have ensured that we've included experts on violence against women and girls on our global advisory committee. So that'll help you understand our perspective, and then we'll move to the next slide, please. So I just want to flash this up on the screen to let you know. You can go to the Women's Refugee Commission website and get access to all of the different reports that we wrote in Bangladesh, in Cox's Bazar, in Italy with the survivors coming over from the Libya, through Libya, through the central Mediterranean route, and in urban areas of Kenya, refugees throughout from the Congo, Sudan, Somalia, et cetera. What we're seeing more and more that as data is becoming available, that in addition to women and girls, perpetrators are also targeting some men and boys, as well as LGBTQ individuals. The sexual violence against men and boys is happening in almost all of the settings that we found, and particularly in migration as well. In general, the GBV IMS, the information management system that we use to understand the data of in our humanitarian emergencies, shows that it's about 10 to 30% of male migrants and refugees that may be subjected to sexual violence. So the Women's Refugee Commission Sexual Violence Project took exploratory research in the three settings that I mentioned. And as well as the direct field research we did, we also, extensively reviewed a lot of other work that's been done by a lot of amazing researchers out there. And we found that there's high unmet needs amongst men and boy survivors. A growing body of evidence is showing that just like women and girl survivors, that male survivors have significant medical, mental health, and other needs. And despite more awareness that we're now seeing around the needs of men and boys, humanitarian workers still feel unclear exactly how to program and to meet these needs. Next slide, please. So one of the things that we heard over and over again in our field research in Bangladesh, in Kenya, and in Italy, and Dale Butcher, I should mention, also conducted the field research with Sarah Chenoweth in Bangladesh, that frontline workers require more clarity and support on how to care for these populations. A lot of staff are confused by their roles and responsibilities, and they're not quite sure how to best provide services. We've seen some disturbing trends where programming that's been targeted and designed to reach women and girls has just been add-on men and boys, and we don't think that works. So what we've done with this guidance note is try to pull together from people who are working in the field as frontline workers, as well as researchers who've done a lot of work on this topic, key actions and considerations per sector, because the key really to responding to the needs of male survivors is to strengthen our multisectoral response. So this guidance note is going to be very grounded in information and recommendations that came out of the field from the research we did, but it's also designed to complement already existing guidance. It's also a living document because we're kind of at the beginning of working with this population, so we're still learning and growing. So it's not comprehensive or definitive. Next slide, please. So this is the definition that we use at the Women's Refugee Commission of against sexual violence against men and boys, which we sometimes in our humanitarian world, we love to use acronyms. We call SVAMB, sexual violence against men and boys. As you can see, sexual violence against men and boys is broader than just penetrative rape. So that was one myth that we also have been seeking to dispel. There's lots of other forms. I'm not going to read out everything on the slide, but you'll see that it includes genital violence, including burning, beating, tying, cutting, and amputating. Also, forced sexual activity or sexual harm against other people. Forced witnessing of sexual violence, both visual and auditory. This is a common thing that's used to torture men, is to force them to watch maybe a loved one be raped. Also includes forced masturbation, and then exposure of boys, particularly adolescent boys, to pornography against their will. So this is the broader definition. And again, you can find all this information in the guidelines. Next slide, please. So the objective of this guideline is to help to strengthen the multisectoral response. As I mentioned, it gives practical tips and recommendations to the different sectors to improve their response to male survivors. So all of the work that we promote for working with sexual violence against men and boys is guided by the same GBV guiding principles that we use when working with women and girls. And these are drawn from, and you can find them in the minimum standards for prevention and response to GBV in emergencies that's available on the GBV AOR website. For child survivors, we're also guided by the best interests of the child. And other critical approaches that we've included in the programming include do no harm, community-based approach, a rights-based approach, and our guiding humanitarian principles. The guidelines are organized by sector to address the health, mental health, and psychosocial support, protection, and their AORs in the child protection and the GBV, but also shelter, wash, and we have information on livelihoods. So each chapter is structured to contain information on the impact of the survivor, because there are certain ways that male survivors are impacted differently than women or girl survivors. It also has key actions for each provider in each sector that was developed from our field visits, but also from extensive consultation with experts in all the different sectors. There's considerations about, how maybe to work with trans and LGBTQ survivors as well. But the focus on this webinar will not be specifically on that. We will probably be doing something in the future more focused on that. But it also addresses the specific needs of LGBTQ as well. Next slide, please. So now I'm going to move over to looking at some of the health impacts. I don't want to steal the thunder of the panelists who are going to talk to you more about their individual sectors, but you can certainly find all of the information in the guidelines. But looking at the health-related impacts for male survivors, they're very similar to female survivors in many ways, but there's a few specific issues that healthcare providers need to be aware of. So trauma to the penis, scrotum, and testes is often common, including bruises, burns, cuts, even amputation. And we have heard of survivors who have survived that. But then it can also manifest by painful urination, erectile dysfunction, bladder injuries, and blood in the urine. So that's some of the key tips for healthcare providers. Rectal and anal trauma is also something that happens, including hemorrhoids, fistulas, fissures, and tears. It may require specialized surgery, but we did find that for most of the cases, they're able to be treated with the general health care that we're able to provide in a lot of humanitarian emergencies. Urinary and fecal incontinence is often a very shameful and stigmatizing aspect to this, and male survivors are very ashamed, and it creates more kind of isolation. Sexual dysfunction can also be something that comes along with that. Sometimes it's psychological, sometimes it is physical, but it's something that needs to be addressed. And infertility is something that male survivors mentioned about that worried them quite a bit and really was an issue of concern for them. And that should also be addressed for providers. We know in the humanitarian emergencies, focusing on male reproductive health maybe is not something that we do very often, but this is a place that we need to maybe speak to them more about. One way that they often express in the somatic body pains is often in lower back pain, and genital or rectal pain, but they may often speak about it through their abdomen and their lower back. And so maybe unexplained back pain like that could be a way of them disclosing. Next slide, please. Again, similar to female survivors, the impact on the mental health can also be very similar: anxiety, depression, suicide, isolation, other negative impacts that we also see with female survivors. But a few specific issues that came out I wanted to flag. Emotional regulation is quite a challenge for some survivors, male survivors, particularly anger and rage. And we know that from our gendered analysis of the way that it's appropriate to respond, that anger and rage is often a way that men feel that they have to express things. It can be a very strong emotion that's driving a lot of negative coping strategies for men. Also, disassociation, depersonalization. We also saw that men and boys often may run away from their village, or they may, become street children, abandon their families, or run away from their home, particularly if the violence is inside the home. And that's an option we don't usually have for women and girls. They're usually not able to just pick up and to move to a different area. But that does have some impact for thinking about unaccompanied children, or, things like that. Escapism, including increased focus on work, confusion and distress about their gender identity. And that's something that is not, across the board, but it has flared up that can, particularly in societies that might be quite homophobic, it might really cause a lot of fear and anxiety for the survivor about what does this mean about my sexual identity now. And again, the sexual dysfunction is of much distress for them, being afraid of being unable to achieve an erection or to impregnate their partners. So next slide. So for the protection sector, we know that in a lot of the countries, sexual violence against men is not really recognized, and particularly not the broader definition that we're using. So this has impacts for them from accessing legal justice. And also the police systems are often quite hostile to male survivors, and it's very, very difficult. Just like for female survivors, it's difficult to disclose, but there's a lot of jokes and mocking, and could even be more violence for male survivors if they disclose. Shelters, finding a place to take a male survivor is quite hard. And we really want to emphasize that shelters that are designed for women and girls should not just add in male survivors. So this is an issue that needs to be looked at. And then refugee settlement and refugee status determination is also an issue too. Next slide, please. In child protection, it's important to know that sexual exploitation against boys is often unreported. In a lot of the places we worked, particularly in the European migration setting, the adolescent boys were more often seen as potential perpetrators rather than also potential survivors of sexual violence as well. Boys can face discrimination if they try to access services that are geared towards women and girls. And because gender norms often allow men and boys much more freedom and ability to move around in public spaces, they actually face sexual exploitation and violence more in these public spaces. And we did see a worrying trend where a lot in workplaces and labor sites that boys are being abused. And there's also, of course, a lot of sexual victimization that we see in detention centers, in prisons, and in like maybe institutions like orphanages or places where we're putting our unaccompanied boys as well as armed forces. Okay, so that's it for me, and giving you a little taste test that I hope you will encourage you to go into the guidelines and look through it yourself, particularly for your sector. I want to encourage you to put your questions in the Q&A or in the chat as well. And as I turn it over to Dale, I'll be monitoring the Q&A so that you'll have a chance to get your questions answered too. Thanks very much.
Thank you, Sarah, and thank you all so much for joining us. As you heard from Sarah, the intent of the guidance was really to try to delineate potential roles and responsibilities for the various sectors and actors engaged in humanitarian response. Sexual violence against men and boys is not just the remit of GBV actors, but rather requires holistic responses. For all of us engaged in humanitarian response, all of us have a role to play. So I'm really pleased today to introduce to you our panelists. We have three panelists with us today. They are Maggie Berputin. Maggie has over 30 years of experience working with Médecins Sans Frontières. She's representing the health sector. She's worked with MSF both at the field level and at the headquarters level, both in emergency response and in longer term strategic public health planning and implementation. She is also a specialist in gender-based violence and sexual violence, including intimate partner violence. Next, I'm going to introduce you to Gallo. Gallo Quizanga is the Global Director of Economic Inclusion for HIAS. He's responsible for leading the technical teams across the agency operations around the world. He has more than 12 years of experience developing and designing quality livelihoods, cash and voucher assistance, and education programs, especially for vulnerable populations. And finally, I want to introduce Karina Hickling. Karina is the coordinator of the Child and Adolescent Survivor Initiative with the Child Protection Area of Responsibility. In her role, Karina is supporting child protection and the child protection and GBV AORs in humanitarian settings to provide comprehensive responses to child and survivors of gender-based violence, including sexual violence. She has worked extensively in Asia, in the Asia Pacific region, in East Africa on child protection, GBV, and sexual and reproductive health services and rights. So I'm so pleased you're all here with us today. Maggie, I'd like to start with you. I participated in the research that the Women's Refugee Commission conducted on sexual violence against men and boys in Cox's Bazar a couple of years ago. And what I learned is that the first place survivors went and their greatest expressed need was for health services. MSF has been one of the most responsive healthcare providers in trying to address the needs of male survivors. Can you tell us what the organization has done and how it is being integrated across your various global operations?
Thank you very much, Dale. Can you hear me?
Yes.
Okay, great. So thanks for the question. As indeed, MSF has been working in the camps around Cox's Bazar since many years, far before the 2017 emergency influx with the refugees from Myanmar. And the response for survivors of sexual violence has been put in place since the very start. But as you have seen, the living conditions of the Rohingya people in the camps, there are multiple needs and priorities, of which creating access to quality care for all survivors of sexual violence is one of the so many priorities for an organization like MSF, being a medical and humanitarian organization. So when we did a community assessment in the camps with the Rohingya population, we did focus group discussions, both with the females and with the males, because we always need to learn from them, like what is their understanding, what is their perception, and what do they see as the health-seeking behavior with regard to the enablers as well with regard to the barriers. And what we learned was for the male survivors, the perceived psychological and social consequences, they varied from, for example, not wanting to be seen in public anymore, or the shame for the family, feeling stigmatized, wanting to commit suicide, but also worries of not being seen as a man anymore, or not being able to be married, to be able to marry in the future. And yes, the community does express that there is a need for health services, but they also stated that men have more difficulties telling anyone because of the perceived blame and shame and all of these potential social consequences. So what do we do in Bangladesh, but also in other settings? And I'll try to keep as short as possible because I think it's a lot what we need to do. The first one is really to engage with community, but also with the formal and non-formal sector, because we need to create access to care. And therefore, we always need to talk about women and girls and men and boys to promote the service utilization, but also at the level of the health facility and I can come back to this later and talk a bit more. But first of all, I think we need to capacitize all of the staff. It's not only the medics, it's also about the guard, it's also about the translator, because everyone needs to be trained about the topic of sexual violence, the different target groups, but also on survivor-centered principles. And I always, when I enter a health facility, how welcoming is it? And how safe does it feel? And will one know where to go? And this starts, of course, in this busy triage, where people wait before they can speak, why have they come to the clinic? And what is then the pathway to the consultation room? And is it different for the different target groups? But then if I look at the medics within the different departments, for example, the emergency room, the pediatrics, the mental health or the outpatient department, have staff been trained to be able to recognize potential signs and symptoms as mentioned by Sarah? And do they feel comfortable to support safe disclosure as well then to respond to a survivor if one would say, yes, this has happened to me? And all of this for me comes back to survivor-centered principles, right? Because it shouldn't be about the gender of the person, but about the needs of the person in front of us, to understand them, to believe them, and to say, it's very good that you have come. It's not your fault, never, ever. And tell me, how can I help you? And then maybe my third and last point is that as we know, survivors have multiple needs beyond the medical care and the psychosocial support. So what is the referral pathway? What is really out there in the setting like Cox's Bazar, in the camps, with regard to the legal and protection services? But let me stop here.
Thank you so much for that, Maggie, and thank you for highlighting the importance not only of taking a survivor-centered approach with that healthcare response, but also the need to really sensitize all of the workers at various levels so that you're really facilitating appropriate access, right, and user-friendly services for those survivors. Gallo, I'd like to move on to you next. You lead HIAS's economic and livelihood programs throughout South and Central America. And HIAS has been particularly strong in targeting survivors of sexual violence in your livelihood programs. Can you tell us why you decided to focus on those population groups and what kind of successes you've had?
Well, thank you so much, Dale. Can you hear me?
Yes.
Super. So good morning, good afternoon, everyone. It's really an honor to be here. And just to frame a little bit my response on this, it is important for everyone to know that we operate in 9 countries in Latin America and the Caribbean, and we are responding to different crises. One in South America, that it's really responding to the Venezuela situation, and one in Central America with the situation of the Northern Triangle. And I mention this because that has been maybe the main reason why we started to prioritize attending survivors of gender-based violence in our livelihoods program. In this region, in the countries where people are arriving, people have the access to work in most of the settings. And the need that they mention at all times, it's the need for a job or for access livelihoods in order to become self-reliant. And that's something that we have assessed in our multiple needs assessment. And that's something that actually led us think to leverage a little bit more our gender lens into our livelihoods program. What it's important to mention is that whenever we started our livelihoods program in Latin America and the Caribbean, what we noticed is that most of our services were really tailored for girls and women. And this particular issue made men not to approach our offices because they didn't feel comfortable and they didn't feel safe. And whenever I say safe, it's really around disclosing and talking about the situation that they were passing. So 2 years ago, we started to target male for our entrepreneurship school with gender lens. And it was very interesting to see that at the beginning, we just had 2 or 3 people coming to our offices in Ecuador, and they were very shy to talk about their story. They actually wanted very tailored services, and it was very hard for us to implement the programs that we had. But after seeing the potential that we had to work with them and with the psychosocial area, we started to incorporate these mental health and psychosocial support services into our livelihoods program so that they can actually feel more comfortable. And whenever they work towards livelihoods, they are also trying to talk and actually talk about the trauma that they had. So in the end of 2018, we target something more than 118 male survivors through our entrepreneurship school with Gender Lens. And it was really interesting because the first thing that they highlighted in this exercise was that for the first time they felt safe after the arrival in the home country. And it was really interesting, in the asylum country. And it was really interesting for us to make sure from that moment that whenever we deliver any service and livelihoods, we are providing a safe space in which male survivors can talk about their situation and can really let us know also which are their concerns, because particularly for livelihoods interventions, we really need to acknowledge if the person is prepared to be engaged in any livelihoods activity. If we engage, for example, a person that is not prepared yet to a job, we are causing a little bit of harm because the company might not be able to respond to the needs of the person and might not be able to understand what is happening. So that's why we really try to assess the livelihoods skills of a person, not only from the perspective of what this person can do in a job, but also if this person is ready from the psychosocial perspective and to be engaged with a livelihoods opportunity. And then talking about very good experiences that we have had, we have leveraged our entrepreneurship school with Gender Lens for male survivors. And another thing that I wanted to mention is that for our poverty alleviation programs, particularly for the graduation model approach, we have published our targeting criteria, and we are prioritizing survivors of gender-based violence. But it's interesting to see that we have also trained the people who are targeting people for the graduation model so that they can also identify male survivors and prioritize them to enter into this program that allow them to get out of poverty. And the third good practice that I have here is actually the work with the private sector in this region. And it has been very key for us to work with the economic actors in the training and capacity building on how to respond to some situations whenever they receive survivors of gender-based violence in the workplace. And in here, we have engaged with multinational, local companies, etc., in very interesting campaigns in which they have identified that the services and the training that we're providing is not only serving refugees, but it's serving them as employers to actually understand a broader situation that might happen also with nationals. So at the moment, we have partnerships with something more than 140 companies throughout the region in which that are working very hard towards the response to gender-based violence. I will stop there, Dale, but very happy to expand my answers if time is
thank you so much for that really comprehensive response. And I appreciate you highlighting that need for some of those wraparound services. So you're not doing the livelihoods in isolation, in this case, in isolation of the psychosocial mental health support that's also needed. And I think that's part of what the guidance is trying to get at. There's roles for these various sectors to play in terms of providing services for male survivors. So thank you for that. Karina, moving on to you. You are a longtime child protection actor and are currently coordinating the Child and Adolescent Survivors Initiative, otherwise known as CASI. And I'd like to ask, has the initiative historically focused on child male survivors? And how might the guidance be of use to you in the work you are leading and coordinating? Rena.
Thank you so much. Can you hear me okay?
Yes.
Excellent. I'm trying to start my video, but I don't think I'm allowed just yet. But anyway, so absolutely, I think just want to say a couple of words on the guidance that is really situating the response to boys as a multi-sector responsibility and encouraging multidisciplinary thinking. And this is very much in line with how we work in CASI and the essence of what CASI is trying to achieve. For CASI, Child and Adolescent Survivor Initiative, we are particularly looking at how to strengthen the coordination and collaboration between DBV and CP actors, but also beyond that to situate the child and adolescent survivors of violence at the center. Just make an addition here. We found in recent work that, for example, education might have a particular important role, especially when responding to child and adolescents or adolescents' need for entry points into accessing services. We also see, of course, that child and adolescent survivors often fall between the responsibilities. We are organizing ourselves in sectors, and therefore, at times, the needs of adolescent survivors, boys and girls, aren't recognized. And it is key to have a collaborative approach to understanding the issues, needs, and access barriers. What is it that stops child and adolescent survivors actually accessing the services? I also think the guidance is important for our efforts in stimulating and developing a better understanding and recognition of the needs of boys. So engaging with boys, LGBTQ plus adolescents, and really listen to how they understand their reality, and also engage meaningfully with boys and girls to address those needs that they identify, the barriers that they identify. And these are different. So boys and girls are experiencing different barriers to services. They are saying that, especially for boys, the fear of judgment, the fear of being regarded as at fault stops them from even trying to access services. So this fear is holding back a lot of attempts for even make an attempt at accessing services. From a survivor-centered, rights-based approach, the child and adolescents have a right to receive adequate responses with consideration for the best interest of the child. And again, what has been said already several times here, but the belief, the reassurance, the need to respond in a non-judgmental manner with some capacity is absolutely crucial. And I think this guide is helping service providers really take on board and reflect on what it is that they can do. It's a manual, or it's a guidance that empowers service providers to think about, what they can do, and then give them tips, practical tips on how they can do it. From a coordination point of view, in humanitarian coordination, I think it's important that we continue working on understanding what those gaps are and the capacity needs, capacity of service providers. How can we support addressing those? And again, as I say, the discrimination is a huge factor, and it needs a lot of work on value clarification with staff, and it needs to be understood that the boys may have a different way of approaching services, a different way of expressing what they have been through. And parts of this is also that boys are often seen as perpetrators of sexual violence. And we see very clearly that boys can be both at the same time, both survivors and perpetrators. And this is asking us as service providers quite deep questions about, you know, looking at our assumptions and how we work with survivors. So I think we need to continue this work on understanding the reality, the issues that adolescent boys are facing. For the referral pathways, which is another area which we look a lot at, is that we perhaps need to work more on looking at how the referral pathways work from the perspective of boys. So how are we making sure that those are also included in the referral pathways, or that we assess what is there from a boy's point of view? And as we heard earlier as well, the lack of safe shelters that are responsive to boys' needs in a way that is not impacting negatively on women and girls is another area which I think this guide will help us highlight. So thank you. Over.
Thank you, Karina. Thank you for that. And I'm really cognizant that all three of you have brought up this fear of judgment and the discrimination out there, which impedes the access, right? So even having those referral pathways in place isn't necessarily enough. We, again, have to go back to a point that Gallo mentioned about that need for mental health and psychosocial support to facilitate the access for when those services are in place. So thank you for that. Mege, back to you. What are some of the challenges in bringing your colleagues on board providing services to male survivors? And will this guidance facilitate uptake, and or what else do you think is needed to promote that?
Well, thanks, Dale, for the question. I must say I'm less worried about bringing my colleagues on board, but I think I'm more worried about a couple of other things. But perhaps first, I think the latest guidance from Women Refugee Commission and partners on male sexual violence is really great and much in line also with MSF's recommendation, as it is so key to adapt the approach not only to a diversity of survivors, but also to the context where you work. So if I think, for example, about the MSF team who works on the boat when they rescue the people from sea, when we talk about engagement, as we know, we are with the rescued people only for a few days on the boat until this disembarkation. So the team works with a small group of men and adolescents who all speak the same language. As you can imagine, there are different languages among these rescued people. And they use a speech then, which is well prepared, which covers the key points. For example, what types of violence do we talk about? And that this violence has medical and psychological consequences, and that care is available on the boat, which is private and confidential, as well as choice if they would like to be seen by a female or male care provider. But we also learned that in the speech for male survivors, for example, they seem to be more sensitive when we talk about sexual transmitted infections. So I think it's really the art to adapt messages and methods also in line with your target group. Because, for example, on the boat, we also have visuals, including in the men's bathroom, about sexual violence and the private and confidential help, which is available on the boat. And I can talk about many different settings. As in my daily work, I supported teams globally, but due to the potential political sensitivity, let me not talk about XYZ location, but I think key is that we adapt our approach to different target groups, but also to the context. For example, I have examples from settings when I look at community engagement and awareness raising, where we can go all in public. We can go door to door, do sensitization, do theaters, puppet shows, but also use social media like Facebook. But also MSF works in settings where we cannot go out and speak directly with the community about sexual violence. But still, we are able to set up a quality response. For example, in one of the settings, more conservative, very sensitive to the topic, we are able to do something because we first did a very careful assessment, then provided training to the key people working in that setting who are well and able to facilitate the safe disclosure. As well, we did set up different pathways. For example, for women and girls, we use a so-called support room for all of the medical and psychosocial support. While for the males, they are seen in the mental health room, where then the medic will join the mental health consultation for the medical examination and the medical care for male survivors. So this needs to be completely adapted to the context. So I always want to think about different target groups, but as well our adaptation to the context. So, and when you ask, what else is then needed with regard to the guidance, I think we need a much stronger collaboration among the different actors in many different areas. One is, how do we get the information out in the community? How do we adapt materials, methods, all of the stuff adapted to context? And the second is, I see, and Karina was talking about that also, in settings where MSF works, in these desperate humanitarian settings, there are rarely functioning support services. So you can imagine the challenge when someone is undocumented. What does it mean for them to be able to access legal support services? Or another challenge when you work in a setting when there is mandatory reporting, or when, as Sarah mentioned, when same-sex relations are being criminalized. And the same also when you have a male survivor who needs immediate safety. There is an immense lack of safe shelter for men and boys, as well for women and girls, both short and long term. So specifically in this latter field, I see an enormous need for all of us to do a much better job. Thank you.
Thank you so much, Maggie. And thank you for really highlighting the importance of culture and context and adapting both your messaging and your services accordingly. I think those are really critical points. Gallo, back to you. What have been some of the biggest challenges for you and your teams in providing livelihood programs for male survivors? And what are some of the remaining needs? And what do we need to learn as a community to be more effective and responsive?
Thank you, Dale. I guess that the most challenging part it's really to incorporate all the other sectors into the livelihoods program. Whenever we were designing our interventions, the most critical part was really to see when the MHPSS services will cross-cut the livelihood intervention, when our cash and voucher assistance will cross-cut the livelihood intervention. So that is for me the trickiest part of designing a program for male survivors. And then the second one, it's really to agree on how is going to be the process to create safe environment, but also how is going to be the process for the people to disclose, because it's not going to happen at once and at the beginning. It's a long process, the one that should pass. And for that, we need to create programming environment from the psychosocial area that then will allow them to jump into our livelihoods intervention. So to create all those pieces and to put all those pieces together was perhaps one of the most challenging parts whenever we really pay attention to attending male survivors of gender-based violence. In terms of challenges, I would say that the disclosure part is perhaps the most challenging for us at the moment of targeting people for the programming, and actually targeting male survivors and provide specific services for them. Because as I mentioned before, in most of the cases, it doesn't happen, this situation doesn't happen at the beginning. And then we really need to create very innovative ways on how to approach a male survivor and how to engage this person in our services. Because what I've learned, and I'm not an expert on MHPSS, I am more an expert in development, but what I've learned is that the situation with survivors of gender-based violence brings a lot of stress. And sometimes this stress translates into frustration, translates into anger, even in whenever we're delivering any livelihoods service. For example, a person that can come just for a seed capital and might be very angry because we are not supplying the seed capital for the person, etc. We know that that reaction can be only provoked by the frustration of the survivor, right? But how to handle the situation was really key. And right now, with the other areas that work at HIAS, which are psychosocial support, gender-based violence, prevention and response, and the legal protection, we're trying to put together all these pieces so that we can also build the capacity in our staff, because we need to begin in-house to really have everyone trained on how to handle and how to manage these cases, because as it has been input in the chats, what it's clear is that we cannot respond the same way we were responding with women and girls survivors of gender-based violence. And to have a specific and tailored training for the staff, it's really key. And then to have a specific and particular training for other stakeholders externally, and in the case of livelihoods with economic actors. But then if we talk a little bit broader on localization, with local actors, with organizations that are working with male survivors and they don't even know how to name them, right? Those are situations in which we are investing a lot of time and resources. So I will stop there, Dale, but I hope I answered your question.
Yes, thank you for those very thoughtful responses, Gallo. And I know we're past time to get to the Q&A, but very quickly, Karina, back to you. The incidents of sexual violence against men and boys, or against boys and adolescents, are getting more attention. You know, we think about the unaccompanied minors transiting through Europe and stuck in Greece, for example. How do you think we all need to step up to ensure their protection and appropriate response services?
Thank you, Dale. Well, I think it's about understanding and recognition of the context that increase the vulnerability of boys and how sexual violence is affecting boys in specific ways. So it's a capacity development that is needed. We need to open our eyes for what's going on for boys. Boys throughout refugee and displacement and in detention, trafficking, child labor, association with armed forces, and as unaccompanied, the risks increase. This is what Mehri was saying. This is what we hear from a lot of places, and we need to be better at picking up on that vulnerability. Capacity, working with service providers to address value clarification and to ensure that they are able to provide the appropriate protection responses. Where there is possibility of or shelters, again, is important. That is really a huge gap for children, adolescent boys, to see how to provide a protection for them. Another challenge is to working, and this Mehu was saying as well, that we are working in contexts where there is very little or limited knowledge about sexuality, and stepping up efforts to ensure that adolescents have access to comprehensive sexuality education. That's me putting on my sexual reproductive health and rights hat in this, but I really do think that that's a long-term investment, that it will yield prevention and potentially break cycles of violence. So I think that is the access, capacity of service providers, and availability of specialist services, determining the entry points in the local context, and working meaningfully with boys so that we are listening and putting them in the center and also in the driver's seat to address some of these issues that are being identified. So working closely with them and also trusting that they have a lot of capacity to actually address these issues themselves. Thank you, and over.
Thank you, Karina. And I think you just provided a really excellent summary for how we all need to move forward. I mean, you highlighted so many points which will be captured, but I want to thank all of our panelists for those really important insights and reflections. And we're now going to open it up for a few minutes for questions. So back over to you, Sarah.
Thanks so much, Dale. You guys answered some of the questions, but the questions were flying hot and fast in the chat and the Q&A. So we'll attempt to get a few of them. I'm going to start with asking Gallo, do you find that the integration of mental health and psychosocial support into livelihood replaces or fills gaps in case management support for men and boys? Do you have any reflections on combining the two?
Yeah, I would say that it cannot replace the case management from the mental health and psychosocial support perspective, but actually it can be a bridge for these people to jump into more development-oriented interventions in a more smoother way. To explain myself better, I guess that mental health and psychosocial support services are voluntary, right? So people will approach, for example, in our case, people will approach the livelihoods area because they really need a source of income. But if we identify that the person is having a specific issue that will affect their performance into any of the programs that we deliver, we actually try to refer internally to the psychosocial area and try to work together as a team, the psychologist and the livelihood advisor, on a strategy that will allow this person to disclose in a safe space, but then to work very hard from the psychosocial perspective and from the livelihoods perspective. I think that what is important to highlight here is that psychosocial support services do not always, just to clarify, that male survivors of gender-based violence will not always disclose in the psychosocial space or in the psychosocial area. So we really need to train all our teams, and that's why we actually engage very hard from the livelihoods team with the psychosocial support area, because we really start seeing that most of the people, whenever they started to see any trust in any of the livelihoods officers, this person will start to disclose in our area, and we didn't have the expertise to respond in the most accurate way. So to actually have this pathway on opening this space, also with a psychologist that it's more specialized on responding to these kind of situations and working together towards a strategy, is what has worked the best in our case management.
Okay, thank you so much for that. Maggie, there were many questions coming your way after your interesting presentation, but I'd like to ask you, a lot of the questions was around the service provider attitude adjustment, behavior change, and training. So how have you managed to achieve that? You said that you're not really having a problem with MSF teams now, and I know, having worked with you in the past, that that's because you've been dedicated to working on this topic for years and years and years. Maybe you could share a few tips.
I think I said that working with my colleagues is not the biggest issue, right? But of course, none of us, I think we ever had any training in our medical curriculums for sexual violence. So when medical staff or non-medical staff start to work with MSF, we need to capacitize them. We first need to make them comfortable with the topic for the issues as I talked about, and specifically about survivor-centered principles. But I think, and you and me, we have been running the SV trainings together. And when we run SV trainings with the field teams, we always have a dedicated module about male sexual violence, as well for other vulnerable groups. So for us, this is always part of the staff sensitization, of the staff training. And normally when I run a training in the field, I first start to sit down with a group of people working with MSF, like a small focus group discussion, and just to explore ideas together. What do you think? What do you think people will do in the community? How do you think MSF can support before we move into the training? As well, before we do the training, I always run a training needs assessment to learn about people's knowledge, skills, and attitudes. Because one may know, but one may not be able to do because of different myths or different perceptions coming from their own cultural background. And normally what I see in the training, because it goes beyond running like a nice PowerPoint, we do different activities. And we try to explore in a non-judgmental way what makes that one feels like that. And creating that safety also, first of all, in the training, which I think allows the teams to start to feel more comfortable also with the topic. So I'm definitely not saying it's not an issue in MSF, but I think we have come a long way, and I see many of the teams themselves bringing up this issue and running these trainings in the different programs.
Thank you so much for that, Maggie. You have such a wealth of experience with this, so we're so happy to have you. I'm going to ask Karina next. Another hot topic that was happening in the chat was talking about women and girls safe spaces, and can we make boy safe spaces or programming for boys? How would you adapt what's out there right now?
Well, I think the starting point again is to understand the needs, to engage with boys, survivors, boys, to understand their reality, and also where they feel safe, what type of services that they would like to access. It's important that we don't compromise what is there for women and girls. So it's not about making existing services stretch further. It's to be able to make a case for the needs of responding to boys' needs as well. So as we know, it is providing safe shelter is a challenge. It's a huge gap, and it needs to be context specific in where we are operating, what the needs are, and what type of resources are available. How can we utilize that in a way that is not also undermining what is there for women and girls? So yes, it's it's an answer that it's back to the context, I think, and taking really the lead from understanding the needs the boys themselves. Thank you.
Thanks so much, Karina. I have one last question for Dale, because Dale, as well as being our moderator, is also, of course, a technical specialist himself. With regards to protection issues, we mentioned in our presentation that sexual violence against men and boys can have an impact on refugee status determination and resettlement. Did you have a few things to say about that, maybe to clarify?
I don't know if this is really going to clarify, but certainly we have seen around the world that violence against men and young men is a justification for their asylum claim, but simultaneously, especially in some of the countries where these individuals are claiming asylum, it is shameful to disclose and potentially dangerous to disclose, right? Sometimes it is the government who is doing the refugee status determination, and hence disclosing something that may seem illegal in that country, a male who has been raped. There's all sorts of judgment that goes on that. So that can impede the asylum process if they don't feel safe disclosing, which then, of course, can impede that resettlement process. So let me stop there with that brief answer. Thanks, Sarah.
Thanks, Dale. Now, of course, many of you are probably disappointed because your questions weren't answered directly, but unfortunately, we only have a short period of time. I do want to point out that we do discuss men and boys with disabilities in the guidance as well, because they are, of course, extremely vulnerable. And we did interview in all of the research that we did in the field research. We made a specific effort to try to interview men and boys living with disabilities to get sure that their perspectives were involved. So I recommend that you go to the guidelines, and you'll find a lot more in-depth information than we could possibly squeeze into an hour-and-a-half webinar. And also to read the different reports and the guidelines, and there's many, many things that are out there. Liza, if you can put up the PowerPoint, I'll give you a few little recommendations we want to leave you with, and then share with you again where we can find more information. Okay, go forward, please. And the next one. One more. It's our beautiful panelists, so you can see them better. Okay, so in the health sector, and this is just a selection of the recommendations that are out there, we of course know that service providers' attitudes towards male survivors can be very problematic, and there are a lot of harmful myths out there about both LGBTQ, but also male survivors, and of course female survivors. So addressing that is a key thing to be done in the healthcare sector, working on the service providers' attitudes. Because the bulk of GBV survivors are women and girls, our healthcare response often sits in OB/GYN or with midwives. And that's because we've shown that it's a safe place for women to come forward and to disclose. But this, of course, is a barrier for male survivors. So without impacting the very important work for female survivors, we need to have additional entry points in the healthcare center. Referral pathways for male survivors' care also need to be identified. In places where we did research in Uganda, Kenya, Jordan, and Lebanon, we saw that there were services for urology and proctology available, but a lot of the care that the men and boys need can be provided in a more generalized setting. You don't have to have extremely specialized services, but you do need to have those in your referral pathway. Next slide, please. For the mental health and psychosocial support, it was touched on here. Gallo spoke about disclosure. One thing that we found is that specifically trying to get male survivors to disclose around sexual violence is maybe not helpful at all. Maybe just speaking about violence in general, it doesn't have to be specifically the sexual aspect of it. You know, unlike with female survivors who have an urgent need to prevent pregnancy, the male survivors often take years even before they actually talk about what happened to them. So developing the capacity to manage also their anger, homophobic and misogynistic attitudes that we sometimes see in male survivors is also very important, because it's related around the emotions that they're feeling related to the violence. We have seen some very anti-women attitudes from male survivors who were abused by women. So that might also be something that needs to be looked into. We really need a gender analysis. Again, it all comes back down to analyzing your population and what is it they need. And providing a gender analysis will help us understand how to better tailor mental health programs for men and boys, because we know that they often do not like to seek out these services. In this section also has some really helpful tips about addressing harmful myths about male sexual violence, and particularly around community outreach, which I know a lot of you were asking about. Next slide, please. So for the protection sector, we know that workplace is a place where sexual exploitation and harassment happens to men and boys as well. And there's rarely complaint mechanisms to help them there. And as we look at SEA and our protection responses to that, we also need to ensure that that we recognize men and boys are also vulnerable to that. Working on training and sensitizing our legal structures and our police and detention centers is urgently needed. Speaking about male sexual violence, there can be done. The Refugee Law Project in Uganda does a lot of trainings with police officers there. We know that different places like the ICRC and UN human rights organizations are also doing that. So the protection sector has a strong role to play there. Community outreach and talking about the taboo and the stigma around speaking about sexual violence against men and boys is also something. And we found that the more that it's spoken about, the more the men can actually realize that's what happened to them and that they can seek services. The next one. For child protection, we want to make sure, of course, that people understand that adolescent boys are also vulnerable to SEA. They we've seen that they also can be forced into selling sex, and that they are often seen as not vulnerable. And we saw this a lot in Greece with the responses there, that the boys were, hanging out with traffickers and drug dealers, et cetera, but this was part of their way to try to make money to go on with their journey as well. And they are vulnerable children as well, and they need to be seen as that. We need better entry points to be able to get particularly unaccompanied minors into sexual violence services. And we need a lot of participatory methods to work with the boys themselves to see where the safety risks are. Because they're out there in the public more so than the girls, we need to also talk to them and see where the danger spots are. And in that section, there is some lessons learned working with sexually exploited adolescent boys that you can look at, as well as a case study in Iraq. Next slide. The GBV sector, of course, has lots of experience working with women and girls in gender-based violence. And so their role in developing referral pathways is very important to make sure that we also can identify services for male survivors and not just wait until the survivor presents itself. The shelter sector has a strong role to play, as we spoke earlier about the lack of shelters for men and boys. We sometimes see this worrying trend where very stressed out aid workers are trying to put a male survivor into a shelter that's been developed for women and girls, and then that makes it unsafe for women and girls. So we can't accept that. We have to find safer solutions for male survivors that don't put women and girls at risk. The next slide. WASH is also a sector that needs to be involved. We talked about the urinary and fecal incontinence, and as that's a big problem for male survivors. And rarely are they able to access adult diapers or sanitary products. And so putting these into the dignity kits and putting these into sanitary hygiene kits as well, because it's very humiliating for them to try to access them. It's very hard to access them, and it's costly as well. So we got some lesson learned from Kenya about being able to provide, sanitary supplies for male survivors as well. And then finally, our friends in livelihoods, and Gallo, it was so great to have you involved here. For men and boys, income generation is so strongly tied to their gender identity. And so working closely with the livelihood sector is very, very important. Both the survivors can face barriers to being able to work, because a lot of men and boys' work is due to their physical strength, working in construction or carrying things. And if they have injuries from the sexual violence, which we see, hernias and problems with the incontinence, they're unable to work. And small surgeries could actually put them back into a livelihoods project and help them regain a lot of their dignity and their feeling of being able to be, healing from this violence as well. So we really think that the livelihood sector is a great place for us to work together as well. And we urge you to do that. Final slide, please. So you can, and we've been putting it here in the chat box for you throughout the thing. You can go to the Women's Refugee Commission website and get all of the research and resource materials that are out there. I want to do a shout out to the work that we did with cultural mediators and helping them make better disclosures, helping male survivors disclose through having sensitized interpreters. But you can find also information about the pilot projects that Women's Refugee Commission took place in Bangladesh, in Italy, and in Kenya. And maybe there'll be some good lessons there for you to help you adapt your programs. And with the GBV AOR community of practice, it's a space of over 800 GBV specialists, and we live to support each other and help each other there. So that might be something you'd be interested in joining as well. So please raise this information in your cluster and sector leads so that we can strengthen our response and have a truly multisectoral response to male survivors. Thank you. I'll hand it over to Angelica.
Thank you so much, Sarah. Such a rich conversation. Thanks for sharing the note. And I think based on the responses to the poll and the comments and questions in the chat, there's a lot to talk about. And I think there's a lot to understand too. And coincidentally, today, the Sexual Violence Research Initiative and the Equality Institute launched a global shared research agenda on violence against women in low and middle income countries. But very interesting, this agenda identifies one of the gaps, more research on sexual violence against men and boys, and also need for more research in humanitarian and emergency contexts. So I think we are really understanding, we need to know more. That's kind of the message also of the guide that we just also shared today. And also, of course, understand the intersection between sexual violence against men and how intersects with violence against women. The SBRI, of course, focuses on research on GBV in low and middle income countries. And we really hope we continue this conversation, bringing voices also from those settings. Thanks for the fantastic guests today, really, really amazing conversations. Thanks for all the participants to very active participation, amazing questions and comments there. The recording will be available in the next days. So thank you again, stay engaged and goodbye.